Are you really going to close one of my veins? Yes. And here why that actually improves circulation. I'm Dr. BenMaamer, board certified general and vascular surgeon, and see what happens when venous reflux is ignored. Today, I will explain exactly how modern vein treatment works step by step, including risk, benefits, recovery, and realistic result. What people think? You need every veins. Closing a vein blocks circulation. It's major surgery. Recovery is long and it's cosmetic. And that sounds logic until you understand the physiology. So let me tell you what actually happens step by step. When a superficial vein develops valve failure, blood flows backward. That backward flow increases pressure and causes symptoms. The key principle is we are not removing healthy circulation, we are eliminating inefficient backward flow. The deep system, the one that's close to the bone, carries the majority of blood return, is around 90%. Treatment goal: seal the malfunctioning vein to stop the reflux, to allow blood to reroute naturally through healthy veins. So what are the type of modern endovenous treatment? Endovenous means from inside the veins. We have first the thermal ablation. It's heat-based. We can use the endovenous laser ablation, and the heat comes from the laser, or radiofrequency ablation. Again, the heat comes from radiofrequency. So we do the ultrasound, do like a map of all the vein. We use local anesthetic. With a small needle, we get the access to the vein. Thin catheter we inserted in the veins, and all this endo ultrasound, we put what they call the tumescence fluid around this vein that we're going to treat, so it will collapse it, make it pain-free, and we deliver the heat in a controlled way. The vein will seal and off. The catheter will be removed, compression stocking will be applied. The procedure will last around 30 minutes and the patient walks immediately afterward. And the closure rate is greater than 90 to 95%. Second option, there is a foam. It's a caustic substance that we inject, is a sclerotherapy. So ultrasound guidance again, we inject the foam into the vein. The body gradually absorb that, and that will seal off the vein. It is best for smaller vein, residual branches for spider veins, and they may require multiple sessions. 3, we call it the stab phlebectomy. We make small nick in the skin, microincision, and what this bulging vein, we may remove them directly, and usually the incision is so small it doesn't need any stitches, but now it's rarely used, this one. What are the benefits? It is minimally invasive. It's local anesthesia only. It's office-based. Same-day discharge, of course, and patient walks immediately back to work the next day, most of the patient. It reduced heaviness, reduced swelling, cosmetic, of course, improvement, lower long-term ulcer risk. Most patients return to normal daily life almost immediately. Always there is a risk, like anything in life and especially in surgery. And common but possible, bruising, usually a few weeks and go away. Temporary tightness, sometimes because of the tumescence. Mild soreness, over-the-counter medication would be more than enough. Superficial thrombophlebitis, inflammation of those veins. Rare but possible deep venous thrombosis. Temporary numbness, rare skin burn, I've never seen it, but they talk about it. Risk minimized by ultrasound guidance. We do everything under vision. Proper patient selection, early ambulation, and of course there is always a follow-up ultrasound. So what to expect after? Let's immediately walk the same day as we said. Mild tightness, compression stocking applied. Usually we keep it for a couple of weeks. For the first 1 to 2 weeks, bruising possibly, firm cord sensation, and that's normal. That's usually the vein that we treat. Gradual symptoms relief. Most patients drive same day, work next day, resume exercise within days. Realistic results, short term, reduced the heaviness, reduced swelling, improved appearance. For the long term, durable vein closure, improved venous insufficiency, reduced skin damage risk. What are the limitations? Treated veins usually stay closed. New veins can develop over time. Very important to know. Some patients need staged treatment. For the spider vein, they may require additional session for the sclerotherapy. This will treat the reflux, but not the genetic. This is a management, not a biological cure. So you would ask, what are the alternative? Compression stockings, symptoms control only, lifestyle modification, walking, observation, of course. Other options, vein stripping. Now, I don't think that there's many people who still use it because now we have this minimally invasive treatment with a great result. This is my message. Modern vein treatment is minimally invasive, local anesthesia, office-based, highly effective, designed to restore proper blood flow direction, and most patients return to normal life almost immediately. I don't explain this to scare you. I explain to this to make you make a decision earlier, not later. This is Dr. BenMaamer. If you believe healthcare in America needs to change, hit follow. We are building momentum one video at a time.